Hello, Dr. Ruchi. Good afternoon.
Good afternoon.
Thank you for joining us today for the interview on healthcare startup.
Thank
As a
you.
healthcare startup facilitator, we facilitate your healthcare startup to reach the right people through our different activities. Annual International Healthcare Conference, webinar, Innovator Club meeting, market access program, training and consulting. All these activities come under InnovatioCuris. Today we are here to share your healthcare startup story, struggles and victories. So tell us about yourself.
Well, I am Ruchi Gupta, and by qualification, I'm a chartered accountant and an MBA. And I also completed my PhD in risk management. Post that, I started my career in academics. I was teaching MBA and MCA students for 10 years, for about a decade. And post that, seeing certain problems in the sector, I started a startup into this. So, coming from a finance background and a teaching academic background, I started on to get into this work of healthcare 3 years back.
What are 3H care?
3H actually is a short form for three different words. One is health, then second is health, and the third is happiness. We help you to get healthy, and that will give you the happiness that you need in your life.
Yeah. What are the challenges you faced towards your startup?
Initially, the first thing was for me to get to like minded people. Post that, when we went into the sector, so for me as an individual, I'm not from this particular background. So, getting the getting into the technicalities of the sector was an initial challenge that I faced. But yes, there were people in my promoter group who have been into the sector for quite long. That was not that big a task, but yes, initially I did face that challenge of understanding the medical fraternity.
What is your healthcare moonshot?
Well, we've been into this sector for some time now, so we want to reach to that level wherein people are not deprived of the health problems that a large sector of this economy, a large sector of India do face as of now. So that is what is our mantra, and that is what we want to do in the future.
And what is your unmet needs in healthcare?
In healthcare, in the past 3 years also, what my observation has been is lack of awareness. Firstly, people are not that aware of preventive healthcare, the concept that can prevent a lot of diseases from happening, while people actually go in for getting themselves tested only after they face certain symptoms, and they go to a doctor to get themselves tested. So that is one thing, that is lack of awareness. The second thing, that people have a lot of options, people have a lot of choices in metros, but then choosing the best one becomes the difficult issue. Thirdly, there tier 3, tier 4 places where the basic healthcare needs are also not met. So these sector people are deprived of those medical problems also, those medical facilities also, which can help keep them healthy in the basic manner. I'm not even talking about the advanced facilities. Just a doctor sitting and you go to the doctor, and the tests and all the basic facilitation with respect to health takes a lot of time because they have to move to metros to get themselves properly tested. So that becomes a very difficult issue for them. And the biggest challenge here in healthcare sector is lack of transparency.
Yeah, right.
People are present, but there is no as such transparency which people can actually see, understand, and then go in for choosing. The transparency is lacking, and that obviously has an impact on the intent as well.
Okay, so this made you work on these problems.
Yes, these are the reasons why we went into setting up the startup into healthcare, and working towards providing that transparency to people. So we have been, up to a certain extent, been able to provide that transparency with respect to the diagnostics segment as of now. With respect to hospitals, that transparency is still not available on the side. But yes, when people do approach us, so then we give them all the information with respect to the hospitals, the procedures, the prices, the facilities, and everything. So, in one form or another, that is also creating transparency for people with respect to healthcare, with respect to healthcare procedures. And then, like I talked about the tier three, tier four cities, so we've set up our own labs also, so that we can cater to those people who look forward to such tests at any point of time, and they can get their reports on time to get themselves treated well.
Give us a brief overview of market in India for your solution.
The market is, if I talk about the public, if I talk about the potential is huge with the huge population of India and the lack of awareness that's present as of now. So the size of the market is huge. There are players into this market, but yes, getting to the depth of this population is going to take a lot of time.
Okay.
Healthcare is in itself a very vast segment wherein there's a huge scope, because you talk about health as in diagnostics, you talk about hospitals, you talk about insurance. All of these things have not penetrated to the deepest sectors of the uh, country.
Yeah, right. You talked about transparency.
Yeah.
What do you think about if there is a transparency in the healthcare and there is a possible chance to data theft of the patients?
No,
What do you
it's not
think about?
about data theft. When I talk about transparency, transparency does not mean the transparency with respect to the patients. The data of the patients is supposed to be confidential, because a person who's suffering from something is his and his family's work and his their effort to make that person healthy. For transparency, I mean transparency for the public to go in for understanding what are the facilities, what are the infrastructures, what are the kind of physicians, doctors, surgeons, the facilities in the centers, the timings and everything. That transparency which helps them choose the what is right and what is best for them. There the data theft doesn't come into place, because there you're just talking about the infrastructure which is already present. So people, what I if I have a 3D machine, 3T machine, so that is something the people should know. So comparing me with a 1.5T machine is not going to be that beneficial. So if I am charging something at 3T, which others are charging at 1.5, that means my working is going to be better than them. Their results are going to be better. But that
Yes.
awareness has to come to the public also. So that transparency, and of course the rates as well. When I talk about infrastructure, that is one aspect wherein the machines and all are covered. But apart from it, it's also important, it's imperative for the person to know what the person is actually shelling out. And is that the amount which is charged everywhere, or it's just one particular center which is charging hefty while others can do it at a better price? So that
Yeah.
kind of transparency is what I mean. That people do get to know what are the available options and they can choose the best possible alternative for themselves.
How different are you from your peers in your approach?
I would say first we are working towards making lives better by providing that. Again, I would say talk about transparency, then I'll talk about giving them that approachability. Because even if you're providing transparency, health sector is a sector wherein it's difficult for the people to get into the technicalities, because a doctor is giving you a certain part of a certain piece of information, but that information is not complete. They only tell you about the tests, they only tell you about the medicines, but then going into the depth of that, understanding about it and all the necessary requisites that are there. So for that, we are working towards making lives better for people. They are able to get to know what they are having and what possibly they can have. There are certain things we are doing as of now, like I talked about, starting on labs also, and making the website transparent for them also. But there are certain things in pipeline which we hope should be able to make lives much better for labs also and for the public also.
Okay.
That is something which is not done by anyone till now. So we are working on certain solutions which should be we should be the pioneers into the healthcare for that.
Nice. What are your expansion plans?
When I talk about expansion as in we do cater to 25,000 locations pan India as of now. But even then, the exhaustive coverage, or I would say a major coverage, is still in Delhi NCR. Its focus is centralized more into Delhi NCR because we are based here. We do have certain team members in other parts of India also, but then having that exhaustive presence in other locations is also very important to provide what we are wanting for the rest of the people also. So the first expansion, we look forward to expanding exhaustively in the other parts of India as well. Secondly, opening of labs wherein we have just started 3 locations as of now. We started 2 locations 6 months back and one we started 2 months back. So those 3 locations, seeing the kind of response we are getting from these locations and understanding that yes, the need is actually there and it's really difficult for people to go to the metros to get themselves treated. We are looking forward to expanding into other tier 3, tier 4 cities also to be able to cater to the basic healthcare needs of these people.
Tell us some of your healthcare and entrepreneurial mantras, and who do you admire?
In healthcare, the mantras, if I say, mantras are just this that yes, we should be really, really um, you know I think we should make sure that yes, we are actually keeping healthy and we should get ourselves tested regularly because health is the most important thing in our life. Whatever we do, the end result is going to be good provided we are working on our health, and we'll be able to do good only if we are able to keep ourselves fit as well. So getting yourself tested and keeping yourself healthy will keep you as well as your family healthy and happy. So that is one thing that I think every person should make sure.
Yeah. And who do you admire?
With respect to
Your healthcare, your healthcare startup.
there are certain doctors who are working in a very different manner. I won't name them, but yes, there are certain doctors who are working in this field with the aim of providing that sensitivity into the industry, not like the rest of the community, rest of the segment, wherein there are a lot of other aspects also covered. So I really admire those doctors who are working for humanity even with that kind of skill and experience that they have.
And what was the most difficult period of your startup?
It was initially onboarding people. Post that, it's been not a joyride, but it's not been that bumpy as well. So
And
initially onboarding like-minded people, having that kind of team which understands your passion and works towards it in that manner only. Initially, it was a little difficult for people to get to know us, and in the very initial period, in the very first year, with nothing in hand, with no website, nothing, just a concept. We had visited the diagnostic center, so initially making them understand what we are planning and what we are looking forward to was a little difficult, but then eventually they all came across, they all came around, and we were able to associate almost 180 diagnostic centers even without any website of ours at that time.
it's very nice.
Yeah.
And what were your assumptions when you entered the market and how that has evolved with time?
Actually, when I started this venture, at that time there was a problem in my family which we had faced. One of my family members was suffering from dengue, and we were not able to get a bed for her at late in the night. So we had visited a lot of hospitals, but everywhere it was like that no beds are available. So we were just running around at midnight, around 2 in the morning. So it was a really difficult process for us. So at that point of, and the result was that I had to approach my family doctor, who's a relative of mine. So, by his approach, by his reference, we were able to get a bed in a hospital, which we had already approached earlier. At that point of time, you realize that yes, if this kind of problem we are facing, then if I talk about the commons, if I talk about the people who find it difficult to go in for paying their health bills, how difficult it will be for them to get to such they cater to such kinds of problems when faced by any of these. So at that point of time, my assumption was that yes, these hospitals, it's very difficult for us to approach them, for common people, for us to approach as public, to approach these hospitals for certain facilities. Similarly, for diagnostic centers also, you have huge lines, and it's really difficult because people don't acknowledge you as we don't get that kind of a response from the reception, from the doctors and all. Even when you're going for consultation, all doctors do not uh, they're not so sensitive to your problems. You're just given 2 minutes time, you're just sitting, you tell your symptoms, and in 2 minutes time you're just given a prescription wherein certain tests are mentioned and you have certain medicines being prescribed to you, and you're out with it. That's it. So that
Yeah.
sensitivity is lacking somewhere. In healthcare, a person needs somebody else to hold your hand and guide you, give you that sensitivity, give you that information, and help you to move forward. You're already into certain problem, be it a health problem, because health problem also has certain financial consequences. So you are already into certain trouble. And at that point of time, if we as humans are not sensitive, we as doctors, we as diagnostic centers, we as, for that matter, service providers, are not that sensitive towards the customer's need, towards the patient's need, it is really difficult to survive. It's very difficult for us to build trust into the customer's patient's mind. If I talk about general psychology, you talk to anybody, it's really difficult for them to change their trust from one provider to another provider. If they have faced one doctor who has been good to them, they do not want to shift because they know the kind of experience they're going to face into the other doctor's uh, clinic and everything. Same ways for the hospitals also. So that trust building has been really difficult. So the assumptions were these only, that the sensitivity is lacking, the transparency is lacking, that kind of atmosphere for the people, that hand holding for the people needs to be worked upon. And how it has evolved, we have been working. There are other players also who've come into the segment, and we've seen certain new hospitals also coming up with this concept of providing to catering to the needs of the people with that sensitivity, which is lacking in those which are which have been present from long times. So that has improved, but still there's huge scope for improvement. So that commercialization is should also be accompanied with sensitivity and transparency.
Okay. What is the insight that you have about your market?
The insight, I would say, when I talk about these cities, the metro cities, there people still have started to have certain levels of awareness, but there is still a lot to be done to make them aware, to make them know about what is there. There are so many new concepts which have come up, like genetic testing and molecular testing. There are so many centers also who are doing certain which are providing such good facilities to the people. So that awareness is lacking. That awareness needs to be worked upon. But apart from it, not just the metros, but there are so many people who are already working on these concepts. But there are so many segments in the country where there's been nothing which has been done with respect to healthcare. So there, having worked in three places, we've seen and we believe that yes, there's huge potential, there's huge scope in these places, because you're not just helping serve humanity, you're not just providing them with the basic facilities, you're actually doing a good deed for them. That insight has to come in, wherein those unserved, unprivileged communities where people need need somebody to cater to those problems has to be brought in.
Share with our audience if there is a book that has made an impact on your life.
I do love reading, but there's no specific one which I feel is. I'm still into. I'm reading one of Warren Buffet as of now, so that should be. That's one of very good books, but not any one specific that I would want to name.
Thank you, Dr. Ruchi, for joining us today. It was a great interaction with you. Hope other startups will get motivated through your story.
Thank you so much.